places, and we have over 140 places that has been identified as risky regions, and also we do see some sporadic outbreak in certain districts. So we have to check the places and also the key population to make sure that the virus shall be contained. We have to mind our own hygiene, wear a mask, wash our hands frequently, avoid gathering, and get vaccinated as soon as possible. As of today, the number of doses of vaccine has been administered reached 1.7 billion doses. So today the theme is to further contain the epidemic. And we have invited Mr. Li Huaqiang from Ministry of Transport, Mr. Liu Haitao from National Immigration Administration, Mr. Han Guangzu from Civil Aviation Administration, Mr. Bian Zuodong from State Post Bureau, and Mr. Wu Shiping from China Railway to participate in the press conference, and also they will address your questions. So now the Q&A session is open. Please identify your media affiliation before you raise the question.
谢谢主持人，我是第一财经的记者。此轮疫情最先在南京禄口机场发生，该机场在外防疫情输入方面存在哪些？
So my question is that this round of epidemic was occurred in the Lukou International Airport in Nanjing. What are some of the weaknesses in preventing the import infection in Nanjing International Airport? And what are the measures will be taken by the other airports to prevent the imported infection? Now I would like to give the floor to Mr. Han Guangzu to answer your question. Thank you for your question. This time, we found cluster outbreak in Nanjing International Airport. There are many factors. For example, we have some weakness in the epidemic prevention and control measures. And also some of people, they slacken their efforts in the containment. And some people, they're not exercising the regulations of prevention and control. So first of all, we have to provide more guidance to the airports and strengthen our inspection to make sure that these people understand the prevention and control regulations. Second, we provide training to the frontline workers at the airport so they understand how to protect themselves. At the same time, we will show humanitarian care to those people who are working at the airport. Also, we'll increase the frequency to roll out NAT to those people. For people who are working for international flights, so every 2 days they will receive the nucleic acid testing. For the other service people and ground staff, we will roll out nucleic acid testing every 3 days. For people at different risk groups, making sure that every week they will receive the nucleic acid testing. As for the features of the transmission of the Delta variant, we will abide by the guidance on preventing the epidemic and making sure that all the people who are working in the international airlines can receive nucleic acid testing in a timely manner, and making sure that we have setting up designated places for people to handle the cargoes and to transport the cargoes as well. To high-risk airports, we also roll out a number of measures to contain the spread of the virus, making sure that for the people who are working in the airport should live in a designated place. For international airports, they will also ensure the smooth logistics for international business. However, it is a very key area for us to contain the spread of the epidemic. So the Civil Aviation Department will work together with the Customs, the Health Commission, the Immigration Department, and to make sure that we could safeguard the safety in the airports. Next question, please. With CMG, recently we do see cases infected with Delta variant. So my question is to the China Railway. As we have a huge traffic in the railway stations, what measures will be taken by China Railway to contain the spread of the virus? Thank you for your questions. Right now, we do see the epidemic has a cluster outbreak in different places in China. So does China Railway, we put people's life and safety as the top priority. We have to abide by the general guideline to prevent the import infection and domestic re-emergence. Based on the actual situation, we have taken the following measures. First, for all the train stations in China, they will abide by the regulation from the local government. For people who are not eligible to travel, we will not allow these people to travel. And also, for some high-risk regions, we will not issue train tickets for these regions to travel to Beijing. And also, we will provide free ticket refund. And we will guide the passengers to have a scientific travel. We would like to reduce the population flow and reduce the risk of cross-infection. Fourth, we will continue to do a good job in the ventilation and the disinfection in train stations and terminals. We will guide all the passengers to wear face masks during their stay in the train station. Also, we will initiate emergency response. We have setting up separation zone for each one of the carriages. Once we found fever patients, we will quarantine these people and also report the situation to local government. Fifth, we will strengthen the management of the railway. We will do disinfection first to all the tracks and the train carriages. We will also better manage the sanitation cleaners to reduce the risk of the cross-infection, to make sure that all the staff working for the train station are safe. And also we will monitor the health condition for all the staff members in train stations. For people who are working at the key positions, we will take effective measures to ensure safe and smooth transportation of the railway. Thank you. Next question, please.
好，谢谢主持人。中国交通报记者提问。最近我国境外疫情输入的病例较多请问交通运输部门将如何做
With Transport Daily,
的外防输入工作？
recently we see a lot of imported cases. What measures will be taken by the Ministry of Transport to prevent the spread of virus through the road transportation, water transport, and the ports? Thank you for your questions. Right now, the global pandemic is still accelerating and the situation is very severe. Especially affected by the Delta variant, we face a huge pressure of the imported infection. So we will provide guidance to all the localities on the epidemic prevention and control in highway, water transport, and ports. We have taken the several measures. First, we will revise our working guidelines. In view of the current situation, we will focus on the epidemic prevention and control in highway, water, transport, ports, as well as the imported coaching logistics. We have come up with a more detailed arrangement so that we can reduce the risk of the imported infection. And second, we will roll out a closed-loop management. For all the drivers and passengers who are in the international vessels, and loading people who are responsible for the coaching logistics, we will roll out a shifting mechanism and also bring these people in designated places for dwelling. And also, we will do disinfection to all the vehicles responsible for the international transportation, making sure that we attend to each one of the details to contain the spread of the virus. And also, we're focusing on the high-risk regions. We will provide guidance to these high-risk regions and we will roll out the nucleic acid testing to people who are working in the highway, water transport, and ports. And every other day, we will roll out the nucleic acid testing to the working staff. For the other people, and we will roll out the nucleic acid testing every 2 days. And also, we will forbid the contact from people inside of China and outside of China. In high-risk regions overseas, we will also focusing on checking the health condition for people from the overseas destinations. And at the same time, we roll out the suspension mechanism. As of yesterday, we have stopped the transportation of 18 vessel companies, altogether 430 vessels. Thank you. Next question, please. With Phoenix TV, right now we see a lot of imported cases, especially in Nanjing International Airport, meaning that right now the situation remains severe. My question is to Immigration Administration, whether we will take more measures to contain the imported cases. Thank you for your question. So right now we do see a rebound of the imported cases, and we are faced with a severe condition to prevent the imported infection. For the Immigration Administration, we pay close attention to the development of the epidemic in different countries. So we are strengthening the border management to prevent the imported infection. Also, we are taking a number of measures to build up a protection shield for China. First, we will strengthen our management for the borders, the ports. For airports, we will set up a designated areas to check all the inbound passengers and the inbound travelers. And we will also strengthen our efforts in the inspection for these people. In seaports, we will also strengthen our efforts in checking people who are traveling to China. Unless necessary, we will not allow people to board on international vessels. We have taken the stringent measures in managing the airport, land port, and the seaport. Especially in the border areas, we have done a lot of patrol and inspection to protect the safety inside of China. And also we want to mitigate the unnecessary cross-boundary population flow. And we will take the stringent measure to issue the visa or pass for people who will travel outside of China. And we will not issue visa to people who do not need to travel outside of China. Second, we will crack down on the illegal activities, including the illegal entry and exit, smuggling, organized crime, drug trafficking, etc. And also, we will crack down on all of those illegal immigration and the stowaways, making sure that there are no illegal entry inside of China. Fourth, we will work together with neighboring countries. Especially, we will work with the Immigration Department and the Border Inspection Department from the neighboring countries to strengthen the management of the border. And we will work together to crack down on all of those illegal activities and illegal trespassing. Thank you. Next question, please.
谢谢主持人，新华社记者提问。德尔塔变异毒株的传染性更强了，这一次，对于交通的场站和
With Xinhua News Agency, and we do see there's a fast transmission of the Delta variant, and definitely will affect the transportation. My question is to the Ministry of Transport. What measures will be taken by Ministry of Transport to contain the spread of the virus? Thank you for your question. For the transportation vehicle and the terminals, yes, indeed, it is densely populated, and it is very crucial for us to contain the spread of the virus through managing these transportation terminals and the transportation vehicles. And also we have to make sure that we protect the transmission from human to human and also protect the transmission from objects to human. So for epidemic-related regions, we advise them to close down some of the transportation routes and the transportation services. For example, some of the taxi services will be suspended in the high and the mid-risk regions. Second, we will continue to improve our working guidelines on the epidemic prevention and control, and making sure that we come up with different measures in different places with different risk levels. For inbound passengers, we do not allow these people to travel to different places inside of the terminal, and also we will roll out the 4th edition of the prevention and control for the international vessels. And we will register the passengers' information when necessary. Third, we will also do random inspection to strengthen our efforts in normalized prevention and control. We will work with transportation department at different levels to further implement the disinfection, ventilations in transportation sites and terminals, and making sure that we do a good job in the disinfection for the transportation vehicles and gesture the information who are taken out of those transportation vehicles. So for people who are working in the logistics, cold chain logistics sector, they should not bring those cold chain food inside of China without valid permit. So I advise all the passengers who will board on the transportation vehicles, make sure that you wear a mask and mind your own hygiene. Let's work together to fight against this pandemic. Thank you. Next question, please. With CGTN, my question is to Mr. Liu from the Immigration Administration. It is crucial to reduce the spread of the epidemic, that for people not crossing the boundary, crossing the border. However, for people who have to go outside of China, how could we facilitate them to administer certain certificates and a visa? I believe this question attracted great attention from the public since the pandemic occurred. In order to ensure the safety and health of our people and stop the spread of the virus from the entry and exit ports, so the Immigration Administration have taken a lot of measures and take stringent measures to issue visa. And for some of the local residents, they actually postpone their travel, and we do have a reduce of number of people who want to travel outside of China, and this has been effectively reduced the risk of the transmission of the virus. And this also shows that our people are responsible for their life and safety. And in the future, we will continue to take strict measures to issue the pass and the visas. At the same time, we will require all the immigration officers to take specialized and targeted measures to specific groups of people. For example, for people who need to study outside and work outside of China, after verification, we will issue visa when necessary. For people who need to attend anti-epidemic conference or people who need to work outside of China, after verification and approval, we will accelerate our process in ensuring visa to these people. And what we are doing will support the recovery of the economy of the world. If these people have some issue in receiving their visa, they could dial a hotline for inquiry. The hotline is 12367, and we will respond to your request when necessary in a timely manner. And right now, the global pandemic is still accelerating. The Delta variant also poses greater challenges to us. Unnecessary, make sure that you do not travel outside of China. Let us work together to consolidate our hard-won achievements in fighting the pandemic. Thank you. Next question, please.
谢谢主持人。人民日报记者提问：当前全球疫情形势压力持续增加，对货运秩序带来
With people's
请
daily,
问交通运输部门将采取
right now we are seeing a lot of pressure from the pandemic, and it will also have a big impact of the cargo transportation. What measures will be taken by the Ministry of Transport to ensure the transportation of the key supplies, vaccines, and other key supplies to global destinations? According to the deployment of the interagency task force, the Ministry of Transport will work with a number of ministries to make sure that we could bring all of those daily supplies to overseas destinations. We will work on the following. First, we will ensure the safe supplies of those anti-epidemic supplies. We will work together with the Security Bureau, and we will have a 24/7 on duty, and also we are opening up a hotline. So right now we already handle over 1,000 cases about the transportation of the anti-epidemic supplies. Also, we mobilize the key supplies and setting up transfer points, making sure that all of these key supplies and daily necessities can be transported unimpededly. Second, we have to make sure that the transportation of the vaccines is safe. We work together with multiple departments, including the Public Security Bureau, the Health Commission. We coordinate with different departments and provide a lot of services to ensure the safety travel of the vaccines. For vehicles who are carrying the vaccines, we will exempt some of the service fees. And right now, we are able to deliver over 5 million doses of vaccines. And also, we need to work to make sure the unimpeded channel for the transportation of the international cargoes. We are using different transportation means. We're also working with the leading transportation companies. In the road transportation and the water transportation points, we are setting up transfer points, making sure that the international transportation could be done in a safely manner. Also, we are dispatching sufficient airline routes to overseas destination, and this has been increased by double digits compared to last year. Thank you.
谢谢主持人，江苏广电总台荔枝新闻记者。我们知道，就是在目前媒体报道以后，南京疫情此次疫情首先被感染的这个机场保障
With Jiangsu Broadcasting Center.
问民航局今后对于机场的运行区域内的第三方人员。
So this time we are seeing for the cleaner getting infected with the Delta variant is actually a outsourced personnel from the Nanjing International Airport. So my question is, what measures will be taken to further manage the outsourcing staff who are working in the airport? In this round of epidemic in Nanjing, we do see some of the loopholes in managing the outsourcing staff in the airports. We have issued a working guideline to better manage the outsourcing workers in the airport. First, we monitor their health condition on a daily basis. For people who have been working for the international inbound flights, for example, the sanitation workers, the ground staff, we need to register their information, and we will check their health condition on a daily basis. If we found any unusual situation, we'll report the situation in a timely manner. And the second, we'll also provide more support for people who are working at the front lines in the airport. we will provide sufficient protective gear to these people. For those who need to board on the aircraft, for example, the ground staff and also the cleaners or any person who need to touch the surface of the aircraft, we encourage them to mind their own safety, and they have to wear protective gears, goggles, protective suits, and other gears to protect themselves. Third, we need to launch a closed-loop management, and also we will roll out a shifting mechanism. So for all these people should stay in the same dwelling places. And also we will transport these people on a point-to-point basis. We will have a designated car to transport these working staff. During their working hours, they should not have any contact to their family members or community members. By doing all of that, we can reduce the risk of the cross-infection. At the same time, we're making sure that all the people who are working in the airport will be fully vaccinated. And also we will increase the frequency of nucleic acid testing to these people. For high-risk groups, so on a weekly basis, we will roll out at least 2 times of NAT to these people. According to their personal information, we will also coming up with an operational menu to all of these people who are working in the airport. We will also roll out trainings to these people so that they could better understand how to protect themselves and abide by the prevention and control measures. And also we will supervise the operation of the outsourcing companies. And in the future, in view of the actual situation, we will continue to improve the prevention and control measures and to revise the technical guidelines on epidemic prevention and control for the transportation airlines and the transportation airports. We will clarify the duties at different parties of the airport. As we have so many entities and parties involved in the airport, and also we have a large number of people who are working in the airport, we have to analyze the infection for all the aircraft. After the aircraft enter into China, we will double-check the disinfection of all of these aircrafts and also provide more training to people who need to clean all of these aircraft. We'll also work with the local government to build up a joint prevention and control network to contain the spread of the virus. Thank you. Next question, please. With Hong Kong media, my question is to the China Railway. I believe there are many people in the trains and the train stations. What are some of the tips to the passengers to protect themselves so that we can mitigate the spread of the virus inside of the train station? Thank you for your question. We have to provide more guidance to the passengers. This is the key to stop the spread of the virus. For those passengers who are taking the train for travel, on one hand, we should refer to the local prevention and control regulation. We will check their body temperature and also check their health code. And during the travel, I advise all of these passengers wear face masks and exercise safe social distancing, avoid gathering. Third, once we found any patients develop symptoms such as coughing, fever, they shall report their situation to the working staff on the train. And third, we will do disinfection to the train stations so that we can cultivate a safe and comfortable environment for the travel. Next question, please. With China Daily, we are aware that for the delivery guy, they actually travel through the cities and actually they are the high-risk groups to get infected. My question is, what measures will be taken by the State Post Bureau to protect delivery guy? Thank you. Yes, indeed, we do have a great number of delivery guy, and they also have a lot of contact of local people. As for the safety of this delivery guy, it is of great importance. The State Post Bureau attached great importance to this issue. Also, we made a lot of deployments. On 7 times, we have revised the operational guidelines on the epidemic and prevention and control in the postal and the delivery industry. First, for all the people who are participating in the Post Bureau, they have to wear the mask, and also they have to exercise social distancing. Also, they need to abide by the local prevention and control regulation and mind their own health condition. When necessary, they have to receive nucleic acid testing. For the delivery men, when they are collecting and delivering the packages and the parcels, they have to wear masks all the time, and they have to exercise and distance with the recipient. And we encourage contactless delivery of all the parcels and packages. And also, for the sorting areas and the office areas of the postal services, we also need to roll out disinfection to all of those facilities. And for enterprises, they have to prepare disinfectants, thermometers, and other anti-epidemic supplies. Third, we advocate the delivery men to get vaccinated as soon as possible. Actually, the delivery men, they're one of the key groups to receive the vaccines. Following the guideline by the Interagency Task Force, in the first half of the year, the vaccination rate is actually above 90%. Fourth, we will roll out nucleic acid testing to all the delivery men. As key population group, according to local regulation, these people should receive random checking of the nucleic acid test. For those who are working in the cold chain logistics sector, all these people shall receive nucleic acid testing. For delivery men who are staying in the places at high risk or mid-risk region, they should be the first to receive the nucleic acid testing. So right now, the implementation of the operational guideline is exercising effectively. So right now, we do not see any cases found because of the content of the parcels and the packages. So right now, we don't see much risk for people to get infected through contact of the service of the package and the parcel, and advise all the residents to mind their own safety. When you're receiving the parcel and package, make sure that you wear gloves and also face mask. After you open up the package, make sure that you wash your hands. 2 last question.
谢谢主持人，我是来自科技日报的记者。如果在列车上发现了阳性的感染者，请问铁路部门有什么技术手段能够快速找到？
With Science Daily, if we found positive cases in the train, what measures will be taken by the China Railway to screen out the close contacts and the secondary close contacts, and how we do the epidemiological investigation? Thank you. So right now, we do see a sudden outbreak of the epidemic in multiple places in China. So it will pose great challenges for the epidemic prevention and control in the railway system. So first of all, we have to provide a safe, a comfortable environment to all the passengers. This is our top priority. For the railway department, we have made up a contingency plan and emergency response mechanism. For people that are getting infected in the train, we have to take immediate reaction. We have to utilize the big data system to understand the information of the infected passenger. And by no time, we will report this information to local epidemic-related institutions so that they could trace the travel history of this infected case. And at the same time, we also screen out the risks in the terminals and train stations. When necessary, we will bring the suspected cases into quarantine. We will do what we can to curb the spread of the epidemic. Thank you. One last question. With China News Service, right now there are some cluster outbreak in China. Also, we are taking stringent measures to contain the spread of the virus. My question is, what measures will be taken by the State Post Bureau and the delivery sector to contain the spread? Thank you for your question. Since the outbreak of the epidemic last year, the State Post Bureau has taken a lot of measures and also considered the overall interest. Especially, we are playing a key role in delivering key supplies and daily necessities to our local people. And recently, we do aware that there is a cluster outbreak in Nanjing and other cities in China. And especially, I would like to say for parcels and packages carrying the imported cold chain food. So we will work with the local customs and the anti-epidemic department to check all of those packages and the parcels. We will collect the samples and do a disinfection to all of those packages. And for some of the people who may have contact to the international parcel or work with international counterparts, and for these frontline workers, we will make sure that these people will get vaccinated as soon as possible. And when necessary, we will roll out nucleic acid testing to these people. All in all, we will roll out the closed-loop management for this group of people. And also, for vehicles that are carrying international parcels and packages, we will do an overall disinfection. Right now, we do face a lot of challenges of the epidemic. The enterprises will work with the local government to protect themselves and also to contain the spread of the epidemic. At the same time, we will work together with the local government to roll out nucleic acid testing to the delivery man. After these delivery men get vaccinated and be tested, and these people will go back to their position to provide delivery services. And by considering the nature of the packages, some of the packages will be transferred to designated places, making sure that we do not have a stacking of all the packages and the parcels. For vehicles who may travel through mid and high-risk regions, the State Post Bureau will work with the local government to work on solutions to resolve all of those difficulties. When necessary, we will issue notifications to the public. Thank you. So in today's press conference, different ministries and departments, they have given us a lot of updates and also answer a question. And tomorrow, we will have another press conference about the containment of the epidemic. That is the end of today's press conference. Thank you.